And here is your question. Right, so if you have read and understood considering a critical care scenario, kindly please tell me how would you manage this patient?
Introduce some emergency.
Sorry? How would you manage this patient?
Case manage people or
Yes.
primary source of.
Yes, it's a trauma case, so.
Hello?
Yes, please continue.
Hello? The
Yes,
primary
yes.
use ABCD resuscitation.
Yes.
Yeah. The airway and cervical spine control. Once I call the patient is able to answer. I want to assume the airway is patent. Otherwise, I want to manage the airway. This patient, GCS is 8, and this we need this patient will manage in an intensive therapy unit.
Yes.
And also be intubated for adequate oxygenation, ventilation. The C-spine needs to be controlled using triple immobilization. Patient needs to be lost in 30-degree head up.
Okay.
Use of hyperventilation to prevent cerebral edema, and also to give analgesia. And then C, I want to take samples, set 2 hypocannula, take samples for blood investigations.
All right.
And also
Thank
to
you. Yes. Can you please tell me? Can you please tell me what is the normal intracranial pressure that you expect?
Normal is 7 to 15 minutes of mercury.
Yes. And in standing, this is lying down, and standing, how does it matter?
7 to 10 minutes.
Okay. Can you give me? Yes. Yes.
7 to 10 minutes of mercury. In standing is 7 to 10 minutes of mercury.
Yes, please. Can you give me some ways to measure intracranial pressure? In ways,
you can do,
yes.
Use intraventricular probe.
Yes. And
intraparenchymal catheter.
yes.
Subarachnoid catheter, catheter.
All right. Yes. If you can classify into invasive and non-invasive, and then tell me, please.
Invasive and non-invasive. The non-invasive is to do Doppler cranial Doppler ultrasound. And
okay. Can you please tell me what are the hazards or dangers of doing lumbar puncture when patient presents with increased intracranial pressure?
Herniation coning.
Yes, very good. Can you define the Cushing triad?
Cushing triad is the array of 3 symptoms that occur following.
Yes, hypertension, bradycardia, and dyspnea.
Cushing triad is hypotension. Sorry,
yes. Yes.
Hypertension, bradycardia, and irregular breathing.
Yes. How would you differentiate it from Cushing reflex?
Cushing reflex is the physiologic neuronal signs shown following raised intracranial pressure.
All right. Can you please tell me? Yes, please. Patient when arrived had a Glasgow Coma scale of 15, and then it became, within 15 minutes, it became less than 8. Why or 8? What happened?
Lucid interval.
Yes. What is lucid interval?
lucid interval is the period between two loss of consciousness, sort of increasing cerebral edema.
Okay, can you please tell me how would you define Monro-Kelly hypothesis?
But what's more?
Monro-Kelly hypothesis.
Monro-Kelly hypothesis, yes. What they describe is that the brain is a core,
not brain,
is a
skull.
rigid structure.
Yes. Skull, not brain. Yes.
The skull is a rigid structure containing three components.
Yes.
These are brain, which occupy about 80%, the
yes.
CSF 10%, and blood 10%.
Yes. And what happens? Yes.
The equilibrium that the component of this, the increase in one, there has to be regulated by a decrease in the other. Usually, when the intracranial pressure is beyond 25, it's about 25 millimeters of mercury. Any change, any increase in any of the components will lead to a drastic increase in the cerebral, in the intracranial pressure.
All right. Okay. Can you tell me how can you calculate intracranial pressure? How can you calculate intracranial pressure?
It is intracranial pressure calculated by intracranial pressure. I know cerebral perfusion pressure is mean arterial pressure minus intracranial pressure.
Yes. Divided by.
So therefore, the intracranial pressure will now be.
Yes.
Intracranial pressure will be.
All right. Okay, we'll move on. Can you tell me? Yes. Can you tell me, please, how if you'll do the CT scan in this condition, what would you? If you can read the CT scan, what would you see or what would you find?
There will be area of hyperdense, biconvex hyperdense lesion.
Yes.
At the right frontal parietal region with midline shift and
midline shift. Yes. How would you differentiate it from extradural hemorrhage? A CT scan
this is extradural.
Yes. How would you differentiate?
This actually depicts extradural.
Yes, this is extradural. How would you differentiate it with the other one?
From the subdural.
Subdural, yes.
And that's actually crescentic shape.
Crescentic shape. Okay, good. Can you tell me if you have to, not in this case, but in a patient, when you have to do the lumbar puncture, can you tell me what are the layers that the needle will pass through from outside to inside?
The skin, the subcutaneous tissue.
Yes.
The supraspinous ligament.
Yes.
The interspinous ligament.
Yes.
The dura, the arachnoid, and the subarachnoid.
Good. Okay, can you tell me and mention few indications for intubation, please?
So
for intubation, what are the indications for intubation? Can you mention few?
Yes, there's need for adequate, there's need for mechanical ventilation.
Yes.
If there's a facial injury or bilateral mandibular fracture.
Yes.
Or if there is a Glasgow score less than or equals to 8.
Yes.
Then
any other reason?
If the
what about in case of burn patient when it involves the face? All right, good. Thank you.
Thank you.